Welcome to my Guardian Home Care YouTube channel with new video about what aging feels like. The silent struggles older adults face, and everyone gets older. But strangely, most of us don't talk about it until aging becomes a problem. Imagine this, an 82-year-old mother refuses help from her daughter. She insists, "I can still do it myself." But what's really happening underneath that resistance? This video isn't about tips or checklists, it's about empathy, understanding. It's about the hidden emotional layers that unfold as we age. For older adults, their caregivers, and the professionals who support them. Aging is not just a physical journey, it's emotional, it's quiet, and often it's invisible. Many older adults experience a deep sense of loss, not just of mobility or memory, but of identity, independence, and purpose. Social circles shrink, routines change, and what once felt like control over life slowly slips away. There's often shame in asking for help with simple tasks, like dressing or preparing a meal. What once felt automatic now takes energy and courage. Behind these small daily struggles are deep emotions, frustration, sadness, and even fear. These quiet moments, forgetting a word, stumbling on the stairs, may seem small to outsiders, but to the person experiencing them, they're heavy. They're reminders that life is changing in ways that can't be reversed. This is what we might call invisible grief. Grief not just for loved ones lost, but for the slow fading of one's own autonomy. It's the kind of grief that builds up silently, over time, rarely spoken, but deeply felt. Many caregivers, even trained professionals, are taught how to assist physically, but not always emotionally. What we see as resistance or stubbornness is often something else entirely. Often behind those behaviors lies a deeper truth: fear, sadness, even desperation. That elderly person refusing to take their medication may not be defiant. They may feel like they've lost control of their body, and this is their last act of autonomy. As caregivers, the most important question isn't always "what should I do?" but "what is this person feeling right now?" True caregiving is more than doing, it's being. It's learning to listen not just to the words, but to the emotions behind them. Connection is more powerful than correction. It might be tempting to correct a confused person or explain why they're wrong, but in that moment, kindness matters more than logic. Sit with them. Look them in the eyes. Let them feel seen, not managed. These moments of connection build trust, comfort, and emotional safety, and that's often more healing than any pill. Aging changes family dynamics in unexpected ways. Slowly, parents become the children, and children take on the role of caregivers. This reversal brings with it a mix of guilt, frustration, and confusion. You want to help, but not to overstep. You want to protect them, but also honor who they've always been. Striking this balance is emotionally exhausting, especially when the roles you once knew start to fade. And amid this shift, caregivers must also care for themselves, which can feel impossible when love and responsibility collide. In this new dynamic, setting healthy boundaries becomes essential. Supporting your loved one doesn't mean doing everything for them. It means helping them maintain their dignity, even in decline. And it means giving yourself space to breathe, without guilt. Emotional fatigue is real, and if caregivers aren't careful, they burn out. Remember, you can't pour from an empty cup. The journey of aging is as much about the caregiver as it is about the one being cared for. Aging isn't something to fear, but it is something we need to understand more deeply. It's not just about growing old, it's about growing human. It's about navigating loss, love, memory, and meaning. The more we see aging through the eyes of those experiencing it, the more compassionate our care becomes. So let's talk about it. Let's ask the hard questions. Let's listen to what older adults often don't say, but feel deeply. Don't forget to like, subscribe, and share this video if it moved you or made you think differently.
Hello friends, welcome to my new YouTube video about aphasia explained, what it is, causes, and how to communicate better. Let's start. Imagine waking up one morning and trying to speak, but the words won't come out. You know exactly what you want to say, but your brain and mouth aren't cooperating. Or maybe you hear someone talking, but the words don't make sense, leaving you confused and frustrated. This is the reality for millions of people living with aphasia. Aphasia is a language disorder that affects a person's ability to communicate effectively. It impacts speaking, understanding, reading, and writing, but it does not affect intelligence. People with aphasia still think clearly, have feelings, and understand the world. The challenge is expressing or comprehending language. Most often, aphasia occurs after a stroke, when a part of the brain is deprived of oxygen. Other causes include head injuries, brain tumors, infections, or neurodegenerative diseases like Alzheimer's and Parkinson's. It can appear suddenly and make daily communication overwhelming, both for the person affected and for their family. In this video, we will break down what aphasia is, its causes, types, and practical ways to communicate better. By the end, you'll have a clear understanding of how to support people living with aphasia. What is aphasia? Aphasia is a language disorder caused by brain damage. It affects the ability to speak, understand, read, or write. Importantly, aphasia does not affect intelligence. A person with aphasia can think clearly and reason normally, but their communication skills are impaired. Imagine your brain as a computer network. All the information is there, but the paths to communicate it are broken. Someone with aphasia may know exactly what they want to say, but struggle to form words, speak slowly, or use incorrect words. Others may speak fluently, but produce sentences that are confusing or nonsensical. There are two key areas in the brain responsible for language: Broca's area, controlling speech production, and Wernicke's area, controlling comprehension. Damage to Broca's area may result in slow, labored speech. Damage to Wernicke's area may cause fluent speech that is difficult to understand. Aphasia can be temporary or permanent, depending on the cause and severity. Early therapy and support can help people regain communication skills. Causes of aphasia. The primary cause of aphasia is stroke, when blood flow to the brain is blocked or reduced. Without oxygen, brain cells in the affected area die, which can disrupt language functions. Strokes that impact the left hemisphere of the brain, especially the areas controlling language, often result in aphasia. Other causes include traumatic brain injuries from accidents, which can damage language centers, and brain tumors, which put pressure on these areas. Infections like encephalitis or degenerative diseases like Alzheimer's and Parkinson's can also cause aphasia over time. It's important to recognize the risk factors for aphasia: high blood pressure, smoking, diabetes, and a history of stroke. Early treatment and rehabilitation are crucial to improving recovery and communication outcomes. How aphasia affects daily life. Living with aphasia affects everyday life in many ways. Simple tasks like ordering food, making phone calls, or writing emails become challenging. People with aphasia feel frustrated, anxious, or socially isolated because communication barriers make interactions stressful. Work life can also be affected. Someone who previously excelled in verbal communication may struggle to complete tasks that require speaking or reading. Family relationships may be strained if loved ones do not understand the condition or how to adapt their communication. Despite these challenges, people with aphasia can lead fulfilling lives with the right support. Social interaction, therapy, and patience from family and friends play a huge role in maintaining confidence and mental health. Understanding that aphasia affects expression, not intelligence, is key to empathy and effective support. Awareness is the first step. By learning about aphasia, supporting communication efforts, and encouraging therapy, we can make life easier and more inclusive for those affected. Every word, gesture, or visual cue can make a difference. If you know someone with aphasia, be patient, listen actively, and focus on their message rather than their difficulty in expressing it. And remember, your empathy and support are just as important as therapy in helping them regain confidence and independence. Please subscribe our Guardian Home Care YouTube channel to get more videos. See you soon. Bye.
Hello friends! Welcome to my new YouTube channel, Guardian Home Care, with the new video about bandaging dangers and instructions for elders. Let's start video now. Do you know that improper bandaging can be dangerous, especially for older adults? Many people think bandaging is a simple act of wrapping a wound or securing a limb. But for seniors, it can mean the difference between healing and harm. Elderly skin is thin, fragile, and heals more slowly than younger skin. A tight or poorly placed bandage may cut off circulation, cause swelling, or even trigger severe complications like tissue damage. In fact, for individuals with heart failure, diabetes, or poor circulation, a wrong bandage could potentially be life-threatening. This is why bandaging must always be done with caution, awareness, and the right technique. In this video, we'll guide you through the dangers of bandaging for elders, when and how to use them safely, and key instructions every caregiver should follow. By the end, you'll feel confident in protecting your loved one with care instead of putting them at risk. 1. Understanding elderly skin and circulation risks. Older adults face unique health challenges. Their skin is thinner, more fragile, and prone to bruising or tearing with even slight pressure. Circulation problems are also common among seniors, especially those with diabetes, heart failure, or peripheral artery disease. A tight bandage can stop blood flow, creating numbness, tingling, or even tissue death. On the other hand, a bandage that is too loose won't provide proper support or protection, leaving the wound open to infection. Knowing these risks helps caregivers take precautions. It's important to remember that while bandages protect wounds, they must be applied with both gentleness and precision. Checking circulation regularly, such as looking for changes in skin color, swelling, or coolness of the limb, is a life-saving habit every caregiver should develop. 2. When should you bandage? Not every cut, scrape, or bruise needs a bandage. Caregivers must know when to apply one. For elders, bandages are generally needed when there is an open wound, bleeding that must be controlled, or to protect fragile skin from friction and infection. However, small, superficial scrapes can often heal better when exposed to clean air. Over-bandaging can trap moisture, leading to skin breakdown or fungal growth. If your loved one has fragile or thin skin, sometimes a protective dressing without tight wrapping is safer. Also, never bandage a wound that shows signs of severe infection like pus, spreading redness, or fever without medical advice. In those cases, immediate professional care is required. Understanding when not to bandage is just as important as knowing how to do it correctly. 3. Types of bandages and their uses. There are many kinds of bandages and each has a purpose. Adhesive bandages are good for small cuts, while gauze pads with medical tape protect larger wounds. Elastic bandages can provide support for sprains, but may restrict circulation if too tight. Hydrocolloid or foam dressings help fragile skin by keeping wounds moist for healing. For seniors, soft and non-adhesive options are often best to avoid skin tears when removing them. Caregivers should keep a basic supply kit with sterile gauze, adhesive-free wraps, medical tape, and scissors. Remember, choosing the right bandage reduces complications and makes recovery faster. 4. Step-by-step bandaging for elders, wounds. When bandaging an elderly wound, follow these steps. First, wash your hands thoroughly. Clean the wound gently with mild soap and water or saline solution. Pat it dry with a sterile cloth. Place a sterile dressing directly over the wound to prevent infection. Then, wrap the bandage carefully, ensuring it covers the dressing but isn't tight. Check circulation. Fingers or toes beyond the bandage should stay warm and pink, not cold or blue. Secure with medical tape that won't pull on fragile skin. Always recheck after 10 minutes to ensure comfort and circulation. 5. Common mistakes to avoid. Caregivers often make mistakes when bandaging elders. The most common include wrapping too tightly, leaving bandages on too long, using adhesive directly on fragile skin, or forgetting to check circulation. Another mistake is reusing bandages, which increases infection risk. Some caregivers also fail to replace bandages daily or when soiled. Remember, cleanliness, proper fit, and daily monitoring are essential. Ignoring these can turn a small wound into a major health crisis. 6. Warning signs of trouble. After bandaging, caregivers must watch for warning signs. If the area becomes swollen, blue, or cold, remove the bandage immediately. If your loved one complains of numbness, tingling, or severe pain, circulation may be cut off. Also, watch for signs of infection, pus, redness, spreading warmth, or fever. If any of these occur, seek medical help right away. For elders with heart conditions, even mild swelling in the legs could signal worsening heart failure, not just a bandaging issue. Never ignore these red flags. 7. Special considerations: heart failure and diabetes. Elderly individuals with heart failure and diabetes need extra care with bandaging. In heart failure, fluid retention causes swelling in legs and feet. Wrapping too tightly can worsen this and impair circulation. For diabetics, even a small wound can become dangerous if ignored. Poor sensation in their feet means they may not notice a tight bandage until severe damage is done. For both conditions, always check circulation frequently. Use soft dressings and avoid elastic bandages unless prescribed. When in doubt, consult a healthcare professional before applying compression or firm wraps. 8. Conclusion and caregiver encouragement. Caring for an elder is an act of love, but it also comes with responsibility. Bandaging may seem simple, but for older adults, it carries hidden dangers. By knowing when to use bandages, how to apply them safely, and what warning signs to watch for, you protect your loved one's health. Remember, gentle, careful, and attentive bandaging prevents harm and promotes healing. When in doubt, never hesitate to seek professional advice. You are not just covering a wound, you are safeguarding someone's comfort, dignity, and life. Please subscribe our YouTube channel to get more videos. See you soon with the next video. Bye.
Welcome to Guardian Home Care. Today, we're diving deep into a topic that affects millions of families: how to care for older adults living with diabetes. If you're a child, spouse, or caregiver of someone battling diabetes in their later years, this video is for you. You'll learn practical, step-by-step advice to ensure your loved one lives safely and with dignity at home. Diabetes is more than just a high blood sugar issue. In older adults, it can become complex due to other health conditions, mobility issues, and medication routines. Most seniors have type 2 diabetes, where the body either resists insulin or doesn't produce enough. What makes diabetes in the elderly tricky is that symptoms can be subtle. Fatigue, confusion, frequent urination, or weight loss are often dismissed as signs of aging, but these are red flags. Awareness is the first tool in caregiving. Here are some key symptoms of diabetes you should never ignore in older adults. Blurry vision, dry mouth and extreme thirst, slow healing wounds, tingling in hands and feet, mood swings or confusion. Routine blood sugar checks help avoid emergencies. Use a digital glucometer at home, ideally before meals and bedtime. Keep a journal or use a diabetes management app to track levels. Target blood sugar for seniors is often 80 to 130 milligrams a deciliter before meals, but always confirm with your doctor. And be mindful of hypoglycemia. Low blood sugar can cause fainting, confusion, or seizures. If this happens, offer juice or glucose tablets immediately. Healthy eating is key to managing diabetes. You don't need fancy foods, just smart choices. Here's how you can help as a caregiver. Create balanced plates: half vegetables, quarter lean protein, quarter whole grains. Avoid white bread, sugary drinks, and processed foods. Stick to scheduled meal times. This prevents sugar spikes. Keep healthy snacks like nuts, boiled eggs, or yogurt ready. Many older adults with diabetes are on multiple medications. As a caregiver, your role in medication management is vital. Tips include: use a weekly pill organizer. Set alarms for medication times. Know which medicines must be taken with food. Watch for side effects like dizziness, swelling, or fatigue. For insulin users, store insulin in the fridge. Rotate injection sites and always check the expiration date. Exercise helps control blood sugar and boost mood. Even short walks can make a big difference. Here are safe activities for seniors with diabetes. Walking 15 to 20 minutes daily. Chair yoga, stretching, light gardening. Movement also reduces the risk of depression and falls. Always consult a doctor before starting anything new. Diabetes isn't just physical. It affects the mind and heart too. Seniors may feel frustrated, anxious, or depressed. What you can do: encourage open conversations. Join diabetes support groups. Celebrate small victories. Avoid blame or guilt around sugar levels. A positive, respectful atmosphere helps your loved one feel in control and hopeful. Diabetes can damage nerves, especially in the feet. Daily foot care prevents ulcers and infections. Do this daily. Check for cuts, blisters, or color changes. Wash and moisturize feet. Use proper fitting shoes. Trim nails carefully. Diabetes emergencies can happen anytime. Always be ready. Prepare. Keep an emergency contact list by the phone. Have a glucose source handy, juice, tablets. Know the signs of high or low sugar. Update the medical file regularly. Another important symptom that is often overlooked in elderly people with diabetes is tension or chronic stress. Emotional stress can actually raise blood sugar levels, especially in older adults who may already be dealing with other health challenges or emotional strain from their condition. Now let's talk about fasting glucose values, which are essential for early detection and management. A healthy fasting blood sugar level is between 3.4 to 6.0 millimole per liter. Prediabetes ranges from 6.1 to 6.9 millimole per liter. Diabetes is diagnosed when fasting levels reach 7.0 millimole per liter or higher. Caring for someone with diabetes is a journey. It takes knowledge, love, and consistency. But with the right tools and support, you can give your guardian a safer, happier life at home. Thank you for watching Guardian Home Care. If this video helped you, please like, share, and subscribe for more health and caregiving tips. And remember, every act of care makes a difference. Welcome to my Guardian Home Care YouTube channel with new video about common medications for seniors. What every caregiver should know. Let's start. As we age, our health needs change. And with that, so does the number of medications we take. For many older adults, managing multiple prescriptions becomes part of everyday life. But with so many pills, doses, and names to remember, it can quickly become confusing, even overwhelming. In this video, we'll walk through some of the most common medications prescribed to seniors, what they're used for, and what caregivers should watch out for, from side effects to interactions. Seniors often take more medications because aging bodies deal with more chronic conditions, like high blood pressure, arthritis, diabetes, and memory loss. According to health studies, nearly 90% of adults over 65 take at least one prescription, and over 50% take 5 or more. This is called polypharmacy, and while it's sometimes necessary, it also brings risks. 1. Blood pressure medications. These include ACE inhibitors, beta blockers, and diuretics. They help control high blood pressure, which is very common among seniors. Examples: lisinopril, amlodipine, metoprolol. Caregivers should watch for dizziness, fatigue, and swelling in the ankles. 2. Diabetes medications. For seniors living with type 2 diabetes, medications help control blood sugar levels. Examples: metformin, glipizide, insulin. It's important to watch for signs of low blood sugar, shakiness, confusion, or even fainting, especially if meals are missed. 3. Pain relievers and anti-inflammatories. Pain management is a big part of senior care, especially with arthritis or back pain. Examples: acetaminophen, Tylenol, ibuprofen, Advil, naproxen. However, long-term use of NSAIDs like ibuprofen can cause stomach issues or kidney problems. Always follow dosage instructions carefully. 4. Medications for memory and dementia. In early stages of Alzheimer's or dementia, doctors may prescribe medications to slow down memory loss. Examples: donepezil, Aricept, memantine, Namenda. While these don't reverse the condition, they may help with daily function. Be aware of possible side effects like nausea or unusual dreams. 5. Sleep aids and anti-anxiety medications. These include medications for sleep disorders or anxiety, but they must be used with caution. Examples: lorazepam, Ativan, Zolpidem, Ambien. These drugs can increase fall risk, confusion, and dependence. Always talk to a doctor before using these regularly. With so many medications in play, medication management becomes critical. Missed doses, drug interactions, or duplicate prescriptions can have serious consequences. That's why every caregiver or senior should use pill organizers, maintain an up-to-date medication list, and consult with pharmacists or doctors regularly. Every 6 to 12 months, ask the doctor for a medication review. They may reduce unnecessary prescriptions, check for harmful interactions, or switch to safer options. Don't be afraid to ask, is this still necessary, or can we simplify this? Medications can improve quality of life, but they also require careful attention. Understanding what each pill does, why it's prescribed, and what risks it brings is the first step in keeping your loved ones safe and healthy. Whether you're a caregiver, a nurse, or a senior yourself, education is the best medicine. Managing multiple medications becomes even more delicate when a senior is taking more than 7 pills a day, which is common in older adults. At this level, doctors often recommend adding a stomach protector, such as omeprazole, to reduce the risk of stomach irritation or ulcers. These small preventive steps can make a big difference in comfort and safety. When it comes to pain management, particularly after surgery or for chronic pain, opioids may be prescribed. But these medications often lead to constipation, a side effect that's not just uncomfortable, but potentially serious. To help manage this, doctors may prescribe laxatives or stool softeners such as Mavacone or lactulose syrup, which help restore balance and comfort in daily life. If this video helped you, please like, subscribe, and share with others who are caring for a senior loved one.
Hello friends, welcome to my Guardian Home Care YouTube channel with a new video about dealing with aggressive behavior due to dementia. Let's start the video. Dealing with aggressive behavior sometimes seems out of nowhere. Name-calling, hitting, shouting, or sudden anxiety. For caregivers, these aggressive behaviors in dementia can be heartbreaking and overwhelming. You may feel shocked, hurt, or even unsafe. But it's important to remember, this aggression is not the person's true character. It is a symptom of their illness, caused by brain changes they cannot control. The good news is, with understanding, patience, and the right strategies, caregivers can manage aggression in a way that keeps both you and your loved one safe while reducing stress. In this video, we'll explore why aggression happens, how to respond in the moment, prevention strategies, and when to seek extra help. Why aggression happens in dementia. Aggressive behavior doesn't happen randomly. It usually has a trigger. Dementia affects brain regions that control memory, emotions, and reasoning. This can lead to fear, frustration, or misunderstanding, which may come out as aggression. Pain, hunger, fatigue, or overstimulation can also spark angry outbursts. Sometimes aggression is their way of saying, "Something is wrong, but I can't explain it." By recognizing that aggression is often a symptom, not a personal attack, caregivers can respond with empathy instead of anger. Stay calm. First response in the moment. When aggression happens, your first step is to stay calm. Do not argue, shout, or try to restrain your loved one unless absolutely necessary for safety. Take a slow breath, keep your voice soft, and use reassuring words like, "You're safe, I'm here with you." Give them space if needed. Sometimes stepping back helps them calm down. Remember, if you react with anger, it can make the situation worse. By staying calm, you set the tone for de-escalation. One of the most effective tools is reassurance. Instead of correcting their reality, validate their feelings. For example, if your loved one is yelling because they believe someone stole their belongings, avoid saying, "That's not true." Instead, gently respond, "I understand you're upset. Let's look together and make sure everything is okay." This calms fear and anxiety, helping reduce aggression. Validation makes them feel heard and respected. When reassurance alone doesn't work, try redirection. Shift their attention to another activity, a favorite song, a snack, or a walk. For example, if they are pacing angrily, you might offer their favorite blanket or start a simple task together. Distraction can break the cycle of aggression and create a calmer environment. The goal is not to force compliance, but to reduce stress by gently guiding their focus elsewhere. Prevention is powerful. Keep track of what triggers aggression: loud noises, certain times of day, physical discomfort, or unfamiliar environments. A behavior log can help caregivers identify patterns. Once you know the triggers, you can adjust. For example, if evenings cause more aggression, create a soothing nighttime routine. If pain seems to be a factor, consult a doctor. Removing or reducing triggers prevents many aggressive episodes before they even begin. Aggression can sometimes become physical. In those moments, safety must come first. If your loved one is hitting, do not try to hold them down. Step back to a safe distance and remove dangerous objects from the area. If you ever feel at risk, call for help. Remember, you cannot provide care if you are injured. Protecting yourself also ensures you'll be able to continue caring for your loved one in the long run. Aggression is not something caregivers should handle alone. Talk to doctors about sudden changes in behavior. Sometimes aggression is linked to medical issues such as pain, infections, or side effects from medications. In some cases, doctors may prescribe treatments to help with agitation, but this should always be carefully monitored. Regular checkups and open communication with healthcare providers are essential to keeping your loved ones safe and comfortable. Caring for someone with dementia can be emotionally draining. Aggressive behavior can make caregivers feel guilty, frustrated, or exhausted. That's why self-care is not selfish. It's necessary. Take breaks, ask family for help, and connect with caregiver support groups. Learn relaxation techniques like deep breathing or short walks to reset your mind. A calm caregiver can respond more effectively in difficult moments. Dealing with aggression due to dementia is one of the toughest challenges in caregiving. But remember, you are not alone. Many caregivers face these moments, and with the right tools, they find ways to reduce stress and protect their loved ones. By staying calm, using reassurance, identifying triggers, and seeking professional help, you can make caregiving safer and more compassionate. Above all, remind yourself, your patience, kindness, and love are making a difference, even if it doesn't feel that way in the moment. Please subscribe our YouTube channel to get more videos regularly. See you soon with the next video. Bye!
Hello friends, welcome to my new video on dealing with eating and drinking problems in the elderly. Let's start. Dealing with eating and drinking problems in older adults is one of the most common, yet most overlooked, challenges in caregiving. As people age, their appetite often changes, and difficulties such as malnutrition, dry mouth, or dehydration can silently creep in. These issues may seem small at first, but left unrecognized, they can quickly lead to serious health problems. In today's video, we will explore how to recognize the signs of malnutrition, why eating less is common in older adults, and what caregivers can do to ensure that their loved ones live comfortably, healthily, and pain-free. Part 1. Why eating and drinking problems matter. Eating and drinking are more than just daily activities. They are essential for survival, strength, and dignity. When an elderly person struggles to finish their meals or avoids drinking enough fluids, it is more than just a personal preference. It can be a sign of deeper challenges, such as oral pain, swallowing difficulties, or a loss of appetite caused by illness or medication. Recognizing these early signs can make the difference between maintaining good health and facing preventable complications like infections, weight loss, or even hospitalization. Part 2. Recognizing the symptoms of malnutrition. Malnutrition does not always appear suddenly. It often develops slowly, making it easy to miss. Some of the common symptoms to watch for include sudden or gradual weight loss, weakness or lack of energy, dry or flaky skin, brittle hair or nails, increased confusion or forgetfulness, reduced muscle mass, frequent illnesses or infections. If a loved one is eating less than usual, skipping meals, or showing physical changes like these, it may be an early warning sign of malnutrition. Part 3. The hidden signs of dehydration. Dehydration often hides in plain sight. In older adults, the sense of thirst diminishes with age, meaning they may not feel thirsty until it's already too late. Signs of dehydration include a dry mouth or sticky saliva, cracked lips, dizziness or lightheadedness, dark-colored urine or very little urination, headaches, sudden confusion. Even mild dehydration can cause weakness, fatigue, and falls. Left untreated, it may lead to urinary tract infections, kidney problems, or hospital visits. This is why paying attention to daily water intake is vital. Part 4. Why older adults often eat less. But why do older adults often eat less in the first place?
There are several reasons. 1. Loss of appetite due to aging, depression, or medication side effects. 2. Changes in taste and smell, making food less appealing. 3. Difficulty chewing or swallowing because of dental issues or throat problems. 4. Chronic pain or poor oral hygiene, making eating uncomfortable. 5. Cognitive decline, where meals are forgotten or ignored. Understanding these reasons allows caregivers to respond with empathy rather than frustration. It is not simply picky eating, it is often linked to genuine health concerns. Part 6. The role of oral hygiene in nutrition. One of the most overlooked reasons for eating and drinking problems is poor oral hygiene. Painful teeth, ill-fitting dentures, or untreated gum disease can turn every meal into an unpleasant experience. For many seniors, chewing becomes difficult, leading them to avoid nutritious foods like fruits, vegetables, and protein-rich meats. Instead, they may rely on softer, less nutritious foods, which can accelerate malnutrition. Maintaining oral hygiene is not just about fresh breath, it's about preserving dignity, ensuring comfort, and making eating a joyful experience again. Daily brushing, routine dental checkups, and proper denture care are simple but powerful tools to protect an elderly loved one's health. Part 7. The pain and its connection to eating less. Pain is a silent enemy of nutrition. Whether it's tooth pain, jaw discomfort, or even arthritis that makes holding utensils difficult, pain can discourage an older adult from eating altogether. Sometimes the pain may not even be in the mouth. It could be stomach issues, ulcers, or other chronic conditions that make eating a dreaded task instead of a pleasure. Caregivers must watch for subtle cues. Is your loved one avoiding certain foods? Do they take much longer to eat than before? Do they wince or rub their jaw while eating? These small signs may indicate that pain is interfering with nutrition. Seeking medical or dental advice early can restore comfort and allow food to be enjoyed once again.
Part 7. Strategies to encourage healthy eating. Once we recognize the challenges, the next step is finding solutions. There are many practical strategies caregivers can use to encourage healthy eating. 1. Small, frequent meals. Instead of 3 large meals, try offering 5 or 6 smaller portions throughout the day. 2. Nutrient-dense foods. Focus on foods that pack more nutrition into smaller portions, like eggs, avocados, yogurt, smoothies, and soups. 3. Soft food alternatives. For those with chewing difficulties, try pureed vegetables, ground meats, or soft fruits like bananas and peaches. 4. Flavor enhancement. Use herbs and spices to make food more appealing if taste buds have dulled. 5. Involve them in choices. Allow your loved one to pick meals from a small selection. Having a choice often sparks more interest in eating. 6. Create a pleasant mealtime environment. A quiet, relaxed setting with attractive plating can transform the eating experience. These small adjustments can make a big difference in ensuring proper nutrition and hydration. Join our Guardian Home Care family to get regular Guardian Care tips. Please subscribe our channel and like and share the video with your network. See you soon.
Welcome to Guardian Home Care, your trusted resource for keeping loved ones safe and cared for at home. Today, we're going to explore a medical condition that affects millions of people worldwide, but can often be prevented with the right knowledge. Decubitus ulcers, commonly known as bed sores or pressure ulcers. Acting pressure ulcers with hosting as universal methods by your district. Understanding the skin and pressure damage. The human skin is a remarkable organ. Strong, flexible, and protective. It's composed of multiple layers, each with its own purpose. When pressure is applied to the same spot over time, especially over bony areas, it compresses blood vessels and limits oxygen flow. This starves the tissue, leading to cell death. This is how decubitus ulcers begin, not from the outside in, but from the inside out. It's like a bruise that worsens, eventually breaking through the skin. Why and where bed sores happen. Bed sores typically develop where the bone is close to the skin. The most common areas include the sacrum, lower back, heels and ankles, elbows, shoulder blades, the back of the head in people lying down for long periods per separate. Pressure is the main cause, but there are contributing factors that make some individuals more vulnerable. Third, risk factors you should know. These are the key risk factors that increase the chance of developing decubitus ulcers. Reduced mobility. Conditions like stroke, spinal injury, or post-surgical recovery. Poor nutrition. Protein, vitamin, or calorie deficiencies weaken skin and slow healing. Chronic conditions. Diabetes, vascular disease, or neurological disorders. Incontinence. Moisture from urine or feces causes skin breakdown. Aging skin, thinner and more fragile. Mental status, dementia or sedation reduces the ability to feel or report pain. These factors often work together, making elderly people the most vulnerable. Third, the 4 medical stages of pressure ulcers. Stage 1, the skin is intact but red and doesn't turn white when pressed. It may feel warm, firm, or soft compared to surrounding tissue. At this stage, pressure relief and repositioning can completely reverse the damage. Stage 2, the skin has opened or formed a blister. It looks like a shallow crater. This is a warning sign. Care must be taken to clean, dress, and protect the area from further injury. Stage 3. In Stage 3, the wound has progressed through the skin into the subcutaneous layer. You may see yellowish dead tissue, and the area may smell or ooze fluid. Infection risk is high. Stage 4. Stage 4 is a medical emergency. The wound may be deep enough to expose bone, tendons, or joints. There's a high risk of infection spreading to the bloodstream, which can lead to sepsis or death. Recognizing infection early. Look for signs of infection such as redness or swelling spreading around the wound, foul odor or green-yellow drainage, increasing pain or warmth, fever or chills, confusion or fatigue in elderly patients. Seek medical attention immediately if you see any of these symptoms. 6. Medical treatment options. Treatments depend on the stage and severity of the ulcer. They may include cleaning the wound with saline or wound cleanser, debridement or removal of dead tissue, surgical or chemical, special dressings that keep the wound moist while protecting from bacteria, antibiotics for infections, vacuum-assisted wound closure, VAC therapy for stage 3 and 4 wounds, surgical repair using skin grafts or flaps in extreme cases. 7. Home-based prevention strategies. You can prevent pressure sores at home by creating the right care environment. Repositioning. Turn bedridden individuals every 2 hours. Use side-lying and semi-Fowler's positions to reduce pressure on the sacrum and heels. Pressure-relieving surfaces. Use alternating pressure mattresses, foam or gel cushions, heel protectors and elbow pads. Skin inspection. Check vulnerable areas at least once per shift or daily. Early detection saves lives. Hygiene and moisture control. Keep the skin clean and dry. Use barrier creams to protect against moisture-related breakdown. 8. Nutritional needs and pressure ulcer prevention. Poor nutrition slows healing. A registered dietitian should guide the patient's meal plan. Increase protein, eggs, poultry, legumes. Get enough zinc and vitamin C for skin repair. Add calories. Healing wounds require extra energy. Consider nutritional supplements if the person has poor appetite. 9. Physiotherapy and occupational therapy. Physiotherapists help improve movement and circulation, even if only through passive exercises. Occupational therapists adapt furniture, beds, and bathrooms to make the environment safer and reduce pressure points. 10. The emotional impact of bed sores. Living with bed sores can cause depression, anxiety, and social withdrawal. Don't ignore the psychological toll. Offer emotional support, patience, and dignity. 11. Supporting caregivers. Caregiver burnout is real. Caring for someone with chronic wounds can be physically and emotionally draining. Remember to care for yourself too. Join support groups, take regular breaks, and ask for help when needed. 12. Legal and ethical care. Responsibility. In some countries, neglecting pressure ulcers can result in legal consequences. As a home caregiver, you have the ethical responsibility to monitor skin integrity. Follow medical advice and seek help when you are unsure or overwhelmed. Empowerment and hope. Bed sores can be devastating, but they're not inevitable. With the right care, environment, support, and education, your loved one can heal and live comfortably. Knowledge is power, and you're not alone on this journey. Thank you for watching Guardian Home Care. Like, comment, and subscribe to learn how to keep your loved ones safe, comfortable, and well cared for at home. We're here with you every step of the way.
Hello friends, welcome to my Guardian Home Care YouTube channel with the new video topic is how to recognize and manage delirium in elders. The many caregivers confuse the two, but delirium is a sudden, often temporary change in mental state, while dementia is a slow, progressive decline. Stress that recognizing the difference is critical because delirium can sometimes be reversed if treated quickly, while dementia usually cannot. Introduce the importance of understanding delirium in elderly care. What is delirium? Define delirium clearly. An acute, rapid onset state of confusion affecting attention, awareness, and thinking. Explain that it often fluctuates throughout the day and may come on within hours or days. Compare it briefly to dementia, which develops slowly. Highlight that delirium is often caused by an underlying medical problem, infection, medication, or sudden health change. How do you recognize delirium? List key symptoms: sudden confusion, trouble focusing, disorganized thinking, hallucinations, restlessness, agitation, or unusual sleep-wake cycles. Emphasize how these changes appear rapidly and differ from normal forgetfulness. Encourage caregivers to observe sudden changes in behavior, speech, or mood. Behavioral observation and monitoring. Explain why careful observation is the first step in managing delirium. Caregivers should note changes in alertness, mood, speech, and activity. Mention keeping a daily log to share with doctors. Describe how to remain calm and supportive rather than confrontational when elders appear confused. What can you do about delirium? Discuss immediate caregiver actions. Keep the environment calm, reduce noise, ensure good lighting, reorient gently with clocks, calendars, and familiar objects. Encourage hydration and rest. Stress that delirium is often a medical emergency. Seek medical help quickly to identify the cause. Medication and medical treatment. Explain that delirium treatment depends on the cause, sometimes antibiotics for infections, adjusting medications, or treating dehydration. Mention that sedatives or antipsychotics are occasionally prescribed, but only under strict medical supervision. Caregivers should never self-medicate elders. Advice on how to approach elders with delirium. Give caregiver communication tips. Speak slowly, use simple sentences, maintain eye contact, and stay calm. Avoid arguing or correcting harshly. Use reassurance, physical touch if comfortable, and reminders of who they are and where they are. Encourage family involvement for familiarity. How long does delirium last? Explain that delirium can last days to weeks depending on the cause and how quickly treatment begins. Some elders recover fully within days. Others may take longer, especially if they have dementia or serious illness. Stress that early recognition and treatment shorten recovery time. How do you get delirium? Cause. List main causes: infections like pneumonia or urinary tract infection, dehydration, side effects of medications, surgery, pain, constipation, lack of sleep, and sudden changes in environment. Explain that older adults are more vulnerable because of weaker immune systems and fragile health. Give prevention tips. Ensure proper hydration, nutrition, regular sleep, pain control, medication monitoring, and familiar surroundings. Encourage family visits and mental stimulation, like conversations or gentle activities. Stress that caregivers are the first line of defense in recognizing and preventing delirium. Close by reminding caregivers that delirium is serious, but often treatable. Stress the importance of quick recognition, medical consultation, and supportive caregiving. Encourage caregivers. Your attention, patience, and love can bring an elder back to clarity and comfort. Please subscribe our YouTube channel to get more videos. See you soon with the next video. Bye!
Hello, friends. Welcome to my Guardian Home Care YouTube channel. Today we will discuss signs of depression in seniors living alone. Depression in older adults is one of the most misunderstood and overlooked issues in home care. When a senior lives alone, isolated from regular social contact, the signs of depression can go unnoticed for weeks or even months. Many of these individuals appear to be managing fine on the surface, getting up, eating, watching TV, but inside they may be suffering in silence. At Guardian Home Care, we believe that understanding these quiet signals is the first step toward real care. This video is a compassionate guide to recognizing depression in seniors who live independently and may often feel profoundly alone. Loneliness isn't just a feeling, it's a burden that weighs down both the mind and body. For seniors who live alone, daily life can become a repetitive cycle of silence and solitude. Without regular conversation, physical touch, or emotional support, even the smallest challenges feel overwhelming. Over time, this kind of isolation begins to erode mental health. Depression doesn't always arrive suddenly. It can creep in quietly, disguised as fatigue, disinterest, or sadness that never quite lifts. One of the earliest signs of depression in seniors is a change in emotional tone. You may notice that your loved one no longer laughs at jokes or responds with joy when you visit. Their eyes seem distant. They stop sharing stories, and their voice lacks the enthusiasm they once had. They may say things like, "I'm just tired today," or "There's not much to talk about." These statements, while subtle, can reveal a deeper emotional struggle underneath. Seniors who once enjoyed gardening, music, cooking, or reading may suddenly abandon these passions. This loss of interest is not just boredom, it's a sign that something inside has shifted. Depression often robs people of motivation, making once loved activities feel meaningless or exhausting. If you notice a dramatic decline in hobbies or routines, it's time to ask why. Eating habits are a key indicator of emotional health. Seniors suffering from depression may stop cooking for themselves altogether. Meals become mechanical or skipped entirely. The joy of preparing a meal fades, and they may begin to lose weight or complain that nothing tastes right anymore. On the other hand, some may overeat as a form of emotional comfort. Both extremes point to a potential mental health concern. Sleep patterns change dramatically when someone is battling depression. Insomnia is common, waking up too early, struggling to fall asleep, or feeling unrested after a full night's sleep. Some seniors may do the opposite, sleeping excessively throughout the day. These disruptions not only drain physical energy, but deepen the sense of hopelessness and disconnection. Social withdrawal is a powerful sign of depression. When an older adult stops answering calls, avoids social visits, or declines invitations they used to enjoy, it's often more than just fatigue. It can be emotional retreat. They may begin to feel like a burden or believe they're no longer important. Left unchecked, this isolation reinforces their depressive thoughts, creating a cycle that's hard to break without outside help. Depression doesn't only affect the mind, it takes a physical toll as well. Seniors may complain of constant headaches, joint pain, or digestive issues, even when medical tests show no cause. These psychosomatic symptoms are very real to the person experiencing them and should not be dismissed. They are often the body's way of expressing inner turmoil. Another warning sign is a noticeable shift in outlook. Seniors battling depression may become unusually pessimistic, cynical, or hopeless. They might say things like, "What's the point?" or "Nothing ever gets better." These aren't just casual remarks. They're often cries for help, hidden in plain sight. Neglecting hygiene and cleanliness is one of the clearest signs that something is wrong. Seniors who once kept their homes neat may stop cleaning altogether. They may wear the same clothes for days or forget to bathe. This isn't laziness. It's the heavy fog of depression, making even the simplest tasks feel impossible. Perhaps the most serious sign is when an elder begins talking about death, not just in terms of making preparations, but in expressing a desire to not wake up or stop being a burden. These comments must never be ignored. They are clear indicators that the person may be in emotional crisis and needs immediate support. If you recognize any of these signs, take action with compassion. Begin by simply being present. Ask how they feel, really feel, and listen without judgment. Help them reconnect with their routine and encourage physical movement, creative hobbies, and social interaction. More importantly, don't hesitate to involve a professional, whether it's a therapist, a physician, or a home care provider. If symptoms persist for more than 2 weeks, or if there is talk of death or deep despair, professional help is essential. Depression is a medical condition, not a weakness, and it is treatable. A combination of therapy, medication, and compassionate home care can restore peace, joy, and dignity to an elder's life. At Guardian Home Care, we believe that no elder should suffer in silence. If your loved one lives alone, check in, listen deeply, and act with love. Sometimes a simple visit, a shared laugh, or a listening ear is all it takes to begin the journey back from loneliness. And when you need help, we're here to walk beside you every step of the way. Please subscribe my YouTube channel to get more video about Guardian Care. See you soon with the next video.
Hello friends, welcome to my Guardian Home Care YouTube channel with new video on early detection of hearing loss in seniors. Let's start now. Hearing loss in seniors doesn't just mean turning up the TV volume or asking people to repeat themselves. It can have a much deeper impact on health and well-being. Studies show that seniors with untreated hearing loss are more likely to feel lonely, struggle with memory, and even develop dementia faster than those with healthy hearing. This happens because when the brain works harder to understand muffled sounds, it has less energy left for memory and thinking. Early detection is key because it allows caregivers and families to step in before hearing problems become overwhelming. Identifying the signs early means seniors can stay engaged with family, enjoy conversations, and maintain independence. For caregivers, it also helps prevent frustration and miscommunication. In this video, we'll now go step by step, starting with the early signs of hearing loss you should watch for in your loved ones. Common early signs of hearing loss. So what are the first red flags of hearing loss in seniors? Many of them are subtle and can be mistaken for normal aging or even forgetfulness. For example, you might notice that your loved one often asks, "What did you say?" Or they may nod and smile during conversations, even if they didn't fully understand what was said. Another common sign is difficulty hearing in group settings or noisy environments, such as family gatherings or restaurants. Seniors may also complain that others are mumbling or that background noise makes it impossible to follow conversations. You may also observe changes in behavior, a senior withdrawing from social events, avoiding phone calls, or preferring to stay quiet in group conversations. These are often coping strategies for hearing difficulties. If you notice one or more of these signs happening regularly, it's time to pay closer attention. Remember, catching these patterns early makes a big difference. Role of caregivers in early detection. Caregivers play a vital role in spotting hearing loss early. Because seniors may not always recognize the problem themselves, it often falls to family members or professional caregivers to notice changes. Pay close attention to how your loved one responds during daily interactions. Do they lean in closer when you speak? Do they struggle to follow along when more than one person is talking? One simple test at home is to talk to your loved one from another room. If they consistently fail to respond or ask you to repeat, that's an important clue. Also, observe whether they keep the television or radio at a volume that seems too loud for others. Remember, your role isn't just to notice these patterns, but also to approach the topic gently. Seniors may feel embarrassed or defensive when hearing loss is mentioned. The key is compassion, reassurance, and emphasizing that help is available. Practical home care tips for supporting seniors. Once you've recognized early signs of hearing loss, the next step is creating a supportive home environment. Small changes can make a big difference. Start with communication strategies. Always face your loved one while speaking and keep your voice clear and steady, not too fast or too loud. Shouting often distorts words and makes them harder to understand. Reduce background noise during conversations.
For example, turn off the TV or music when talking. Make sure the room is well lit so your loved one can also use visual cues such as lip reading and facial expressions. Technology can also be your ally. Many affordable devices are available, such as amplified telephones, wireless headphones for TV, and even smartphone apps that transcribe speech. Encourage your loved one to practice social interaction instead of withdrawing. Family games, shared meals, or reading aloud together can boost both hearing practice and emotional connection. By making the home more communication-friendly, you help your loved one feel included, confident, and less isolated. When to seek professional help. While home care strategies are valuable, there comes a point when professional evaluation is necessary. If your loved one struggles despite home adjustments, such as still missing conversations or avoiding group activities, it's time to schedule a hearing test. Audiologists can measure the exact level of hearing loss and recommend solutions, ranging from hearing aids to medical treatment. Early professional help prevents hearing loss from progressing unnoticed and gives seniors a chance to adapt more easily. For caregivers, encouraging this step can sometimes be the hardest part. Many seniors may resist, saying, "I hear fine," or believing hearing aids are uncomfortable or unnecessary. In these cases, frame it as a health checkup, just like visiting the eye doctor or dentist. Emotional impact of hearing loss. Hearing loss is not just a medical condition, it carries an emotional weight. Seniors who struggle to hear may feel embarrassed, anxious, or even angry. Imagine being in a room full of people, but feeling like you're on the outside of every conversation. That sense of isolation can quickly lead to depression and withdrawal. Caregivers should be aware of these emotional effects. Encourage seniors to share how they feel instead of bottling it up. Offer reassurance that they are not alone and that solutions exist. It's also important to maintain a positive home environment. Celebrate small victories, like when your loved one successfully follows a conversation or uses a new hearing device. Every step forward helps restore confidence and joy. By supporting emotional health is just as important as managing hearing loss itself. A caring, understanding approach builds trust and ensures seniors feel valued and connected. Final thoughts and encouragement. Hearing loss in seniors is common, but it doesn't have to steal the joy of everyday life. With early detection, compassionate caregiving, and the right professional support, seniors can remain active, connected, and confident. As a caregiver, you are the first line of defense. By noticing early signs, adjusting the home environment, and practicing clear communication, you make a real difference in your loved one's quality of life. If you suspect hearing loss, don't wait. Take gentle steps to encourage a professional hearing test. The sooner the issue is addressed, the easier it is to manage. Remember, your patience, kindness, and attentiveness are powerful tools. They not only improve hearing challenges, but also strengthen bonds of love and trust. Thank you for joining us here at Guardian Home Care Tips. If you found this video helpful, please like, subscribe, and share it with others who care for seniors. Together, we can make every home a place where seniors feel included, respected, and truly heard.
Hello, friends. Welcome to my Guardian Home Care YouTube channel with a new topic: entertainment ideas to keep the elderly engaged and happy, bringing joy to their everyday. What if I told you that you could make someone's entire day just with a simple act of kindness? Today, we're diving into something really special: how you can help make an older person's day a little brighter, a little easier, and a whole lot more joyful. It doesn't take much, but it can mean everything. At Guardian Home Care, we believe that aging should never mean isolation or boredom. Entertainment isn't a luxury, it's a necessity. It brings back life to routine days. Whether you're a professional caregiver or a loving family member, simple, thoughtful entertainment can boost an elder's mood, memory, and even physical well-being. 1. Music. The healing power of sound. Music is a time machine. One melody can take an elderly person back to their youth, to their first dance, their wedding day, or childhood home. It sparks joy, unlocks forgotten memories, and soothes the soul. Whether it's classical, jazz, oldies, or soft hymns, music creates emotional connection and peace. Encourage participation. Even light clapping, foot tapping, or playing along with a small instrument can be uplifting. These tiny moments of engagement foster joy and connection, sometimes more than words can express. 2. Arts and crafts. Creative joy. Creativity never grows old. Arts and crafts provide a gentle way to express feelings, work with hands, and focus the mind. Simple painting, coloring books, card making, or clay modeling help enhance motor skills and relieve stress. The focus is not perfection, it's the joy of creating. Making something to give to others adds purpose. A handmade card or small painted rock isn't just a craft, it's a message of love and meaning. 3. Gardening. Therapy through nature. Gardening connects us with life itself. For seniors, especially those who once loved tending to their own yards, this activity can be deeply rewarding. Whether it's potting a few herbs indoors or tending to a flower bed outside, gardening promotes movement, fresh air, and relaxation. Even a small potted plant offers a sense of responsibility and care. Watching something grow, something they nurtured, can be incredibly fulfilling. 4. Puzzles and brain games. Mental fitness. Mental stimulation is just as important as physical care. Crossword puzzles, Sudoku, card games, or even trivia quizzes keep the mind sharp and alert. These aren't just time fillers, they're cognitive tools that improve focus and memory. Group games add social connection to the mix. They inspire laughter, spark conversation, and strengthen relationships. For those with memory conditions, simpler games or picture-based puzzles are perfect. 5. Reading and storytelling. Words that inspire. A good story can light up the imagination at any age. Reading to a senior, or encouraging them to read aloud, can bring comfort, spark memories, and reduce anxiety. Choose books with large print or audio versions for those with vision difficulties. Storytelling doesn't have to come from books. Invite them to share their own life stories. It gives them a sense of importance, legacy, and connection to their past. 6. Gentle movement and exercise, body and mind. Movement isn't just for health, it's also entertainment. Gentle exercise like chair yoga, light stretching, or Tai Chi improves mobility, reduces pain, and lifts the spirit. These sessions become fun when paired with music, encouragement, and community. Even 5 minutes of movement a day can make a difference. Encourage what's comfortable and safe. The goal isn't athleticism, it's joy in motion. 7. Movies and shows, comfort through stories. Movies are magical. They bring us laughter, tears, and nostalgia. For seniors, old classics or uplifting shows can be incredibly comforting. Watching a familiar film from their youth can transport them to a different time, one filled with memories and meaning. Create a cozy viewing space. Add popcorn, warm socks, and soft blankets to turn a regular day into something special. 8. Simple social activities, companionship over competition. Sometimes the best entertainment is simply being together. Host small gatherings like a tea party, bingo session, or story circle. Even if it's just 2 or 3 people chatting over coffee, the social connection has lasting effects on emotional health. Games don't need to be complex. Dominoes, memory matching, or even storytelling dice can bring laughter and lightness. 9. Memory boxes and keepsake projects. Creating a memory box filled with photos, trinkets, and letters is both a personal and engaging project. It helps stimulate memory, encourages conversation, and provides a calming sense of familiarity. These keepsake activities preserve their history and open the door for meaningful conversations with family and caregivers. Final thoughts. Entertainment is care. At the end of the day, entertainment for the elderly isn't just about activity, it's about connection, purpose, and joy. When we bring happiness into their daily lives,